we are going to cover today the small intestine. So before we begin with the small intestine, the general features of this particular GI, let's discuss about it. So how many layers in the GI system microanatomy we have seen? 4 layers. How they are called? Alright, split down this mucosa. What do you see in the mucosa? Epithelium layer, under to it we call them as lamina propria, and then we have this muscle layer, muscularis mucus. So this same orientation of these particular 4 layers, including this hub layers which is present in the epithelium, in the mucosa we have this. So only changes what we see here in GI system of this particular abdomen or GI system of these small intestine is that we change this particular like epithelium layers, that means cells which is present in it. So we are going to see this particular 4 layers top down, we call them as mucosa. Then we have this submucosa. Then we have this particular muscular externa which have got 2 layers, inner circular, outer longitudinal, and this adventitia. Now this mucosa can be split into 3 layers. We have this particular cells which is present on it, we call them as epithelium layer. So epithelium layer cells varies, it may be flat cells, column cells, cuboidal cells, spaced with these particular flat cells, or maybe something else. Then we have this connective tissue which is feeding these particular cells, we call them as LP or lamina propria, which is feeding this like glands and like lymphatics, nerves, etc., connective tissue placed in it. And these things are resting on a muscle layer, we call them as muscularis mucosae. So these 3 are within this particular submucosa there, and a mucosa layer is there. Submucosa, we have this particular bottom layer below this mucosa which is also filled up with the glands, neurovascular structures, etc., which is present in it. Then we have this particular tough structure to give integrity to it, we have the muscle layer to hold this particular thing together, and outer covering or wrapping material, final thing which is holding this. In this particular small intestine, we can split it, this particular small intestine, based on this length which is extending from this particular end of the spiralus. So we have this particular 4 divisions of the small eye. That means we have this particular duodenum, then we have this jejunum, then we have the ileum. We have 3 segments are there, and then we have this particular large intestine starting with. So these 3 segments have got little bits like a difference between this particular microanatomy of this small intestine. Duodenum, jejunum, and ileum have got little difference. Largely this particular element is more or less the same. Now the hallmark to identify this particular small intestine is that there is a presence of a finger like projections which is known as villi. So this particular finger like projections is largely present on this layer mucosa, and on this particular mucosa which is going on a projected finger like this. So it looks like a finger, plenty of them are present. So this is a hallmark. So whenever you are going to see this particular small intestine, you will go and look for this particular finger like projection, we call them as villi. So these villi are kind of like a mucosa layer which is this epithelium layer which is going to move up. So this particular thing we call them as finger like projections, also known as evagination, which is moving up, we call them as evagination, which we call them as villi. Now this particular villi which is making some kind of like bulginess within this particular mucosa element of this small intestine. So we have this particular, all this duodenum, jejunum, ileum have got this hallmark feature which is known as the villi. Now apart from this particular finger like projections which is moving up from the surface level, we have some downwards tunnel as well. So this particular bottom of this villi, we have may see some of this particular element dropping down and making some kind of pits. So this kind of pits we call them as cone of Lieberkühn. So this particular thing which is going down from the surface, which is holding some kind of glands within this particular epithelium layer of this particular small intestine. So this particular glands which is dropping down is a kind of thing that we have to look into whenever you are going to study this particular small intestine, apart from this particular finger like projections. Under to that we have this particular submucosa which is present in it. So this particular submucosa layer have got some features which different from different segments of the small intestine, and this third layer which is the muscle layer which have got more or less the same similarity, doesn't have much more changes, and adventitia doesn't have any changes either. So this particular histologically, whenever we are going to identify the small intestine, we are going to focus this mucosa, what are the changes there in the mucosa, and the submucosa, which have got little bit difference between these particular segments. Now, whenever you are going to identify at the undergrad level, in the small intestine microanatomy, we do not seek this particular explanations whether you understand this is duodenum cross section, jejunum cross sections, or ileum cross sections. If you largely can broadly can say this is a small intestine cross section for microanatomy, which has got consisting of these features, mucosa having, submucosa having, and muscularis, etc., etc. 4 layers like this, that's good enough. But if you can dig deep, like why you are saying this particular duodenum, why this you are saying this is jejunum or ileum, if you know that, that helps out to rationalize some of the clinical points. But if you cannot remember whether this belongs to duodenum, jejunum, or ileum, just don't go for it. Just like say that it is a cross sections of small intestine and which has got features, that is sufficient enough to score 100% marks. Clear? So whenever you're going to see this particular features in this particular region, we're going to see this mucosa, submucosa, and muscle layer, and this adventitia. These 3 and 4 are same in irrespective of all the small intestine cross section. Mucosa and submucosa have got little bit difference in it. So out of this, take this particular mucosa. So mucosa have got like cells. The cells which is present in here is of single layer. So these particular cells which you are seeing here is single layer. So why you call them as single layer cells? We call them as simple. And this particular cells is looking like cuboidal or columnar. And in between this particular cuboidal columnar cells, we may have this particular secretory glands which is present as a goblet glands, or some kind of secretory elements may be present on it. So this particular simple epithelium cells, that means a single layer cells which is lining in. Deep to that we have the lamina propria. The lamina propria have got like connective tissue. Now the feature which is hallmark for this epithelium with the lamina propria, they go on a finger-like upward projections like this. We call them as villi. The shape of the villi may vary from duodenum, jejunum, and ileum. If you can remember, good. If you cannot, just don't go for it. Just finger-like projections which is present on it, which have got lamina propria also present in it. Now, if you make a cross sections of this particular lamina propria with this particular epithelium layer, which is present within this particular villi, inside to it, we see that there is a presence of a central core of lacteals, and as well as we see that there are presence of the blood vessels which is present on the sides. That means we have the arterial side and the venous side presence on and having this kind of orientation. So we have this particular villi. If you just like make a dig into it, what exactly present in it, this is composed of cells which is present in here, simple layer of the cells which is present in here like this, and it has a lamina propria which is layer 2 of the mucosa which is also present inside, and then within that we find a central collecting channels which we call them as central lacteals, and as well as it has some kind of arterial blood supply and venous end as well. So arterial and the venous one is communicated with the other. That means blood is coming through here and getting out of here. But this lacteals having blind end. That means it begins here and ends here, and it communicated with the other one and eventually continues with the final central lacteal system. The outline of these particular lacteals are so they are capable of absorbing or this particular pulling up this particular fatty contents. So they run through these lacteals, eventually they run into the lacteal system, and they run like this, wrapped around by some kind of protein molecules which is known as apolipoproteins. So they are transported like this, and this particular venous end and capillary end, and as well as this particular arterial end of this particular blood vessel network, they are absorbing this particular protein molecules or these particles which is related to other than protein molecules, vitamins, etc., etc. They are absorbed through it, and once they are absorbed through, they run through a system we call them as portal venous system, which goes to the liver system, and then they are going into mainstream. So this particular the villi, which the lacteals and the blood vessels, they are present because of the absorbing things. So what are the functions of this? They are increasing the surface area for the absorption, so that in a quick time they can absorb a huge amount of the food particle that is coming to the small intestine in different zones, different regions. As well as this particular glands which is present in here secrete some kind of enzymes, secrete some kind of like chemical substances, or secrete some kind of like hormones which is required for survival of this environment which is present in it. Alright. So again, to come into the what exactly we are going to see, that we are going to see this particular finger like projections, and on the base of the finger like projections we may see an invagination to it. Invagination cells, which is we see that these particular cells are simple cube cells which is present in this particular mucosa, interspaced by some kind of like a goblet cells. This particular invaginated area which is present in here, we see the cells which are largely column cells. Now within this particular epithelium cells which you are seeing here covering this particular finger like projections, within this we see that this particular plasma membrane also undergoes some kind of projections like this. We call them as microvilli. This microvilli again present on the cell membrane. That means if you just like take this particular epithelium which is the cuboidal cells, this particular plasma membrane of this again shows this kind of projections like this. These minute projections we call them as microvilli. Again this increases the surface area, so that this particular food material which is that broken down into small segment, amino acid, monosaccharides, etc., they runs through these particular areas, and this particular individual areas catches up and absorbs this particular and transports this to deep to it to this particular lacteal system or the blood collecting system, and eventually gets absorbed going through this particular the portal system or this particular lacteal system. So this particular functions of the small intestine is largely for absorption of food materials. What kind of food materials? We have three basic components. We may have a carbohydrate, may have the fats, and as well as amino acids or protein substances. So they are transported differently in different domains. The fatty acids or these things runs through the central dead end which is known as lacteal system, and these carbohydrates and the proteins are going through this particular blood collection system. So carbohydrate protein absorbed together goes to the portal vein and eventually to the liver, and may be stored or may be just like utilized in the system. Fatty acids goes through these lacteal systems, so that goes to the thoracic duct system that runs into that particular elements. This is how this particular food material is transported. But for us, what we are going to see this particular microanatomy of this region, we are going to find this particular projections of this particular epithelium with the submucosa tagged in here. We call them as villi. So these particular villi shapes like finger or like have got fern like pattern or different types depending on duodenum, jejunum, ileum. These regions are there which is having this kind of features. And muscularis mucosae may be just like having a continuous or maybe bridged, doesn't have much of like significance though, because of this muscularis mucosae, this third layer of this particular mucosa, we do not just like actually look into it. Now this coming to the submucosa over there, this submucosa of this particular regions, duodenum, jejunum and ileum varies. How do they vary? The submucosal layer, which is layer 2, have got little bit changes. So the submucosa, which is I would recommend you to memorize out of here, is the ileum region. So ileum, if you just like take a cross sections of the ileum, the submucosa of it have got tons of lymphatic nodes like lymphatics, lymph nodes which is present in it. So this submucosal layer, we see these collections of the lymph nodes present in it. We call these lymph nodes as Peyer's patch. Now this is lymph nodes are defense regions or defense areas. So this ileum of this small intestine domain have got submucosa fitted with these collections of this circular body. We call them as lymphatic aggregates or lymph nodes which are present in it. These lymph nodes we call them as Peyer's patch. If you have diseases, some kind of diseases, this particular Peyer's patch or the lymph nodes enlarges and may encroach to this particular mucosa even. So from the submucosa, they may just like climb up and reach to the mucosa and bury there. So this particular region, say for example, we have a disease, we call them as enteric fever. In common name, we call them as typhoid fever. So if you have a typhoid fever, we see that there is a hypertrophy of the lymph nodes which is present in here. So this particular Pear's patch or this particular ileum region submucosa, they become swollen, enlarged, they become hugely swollen like this. So this enlargement of the submucosa matters into this particular region. Other than this, duodenum and jejunum have got some features, we call them as presence of the submucosal glands or not. But to me, when you come up as a clinician later on, this particular thing matters. Whether you have the Brunner's gland or not, as a physician doesn't have much of impact. For us to practice day-to-day life, to becoming a physician, this presence of this particular lymph node enlargements or Pear's patch matters to us, because we gonna see lot of patients who are coming from typhoid fevers. So this particular Pear's patch, what do you mean by the Pear's patch, and why this particular Pear's patch hypertrophies or enlarges, that matters to us. So I would recommend about the submucosa, if you have to remember anything, submucosa of the ileum region have got lymph node collections or lymphatic aggregates. We call this as Pear's patch. Now this Pear's patch normally present, but it goes in volume. That means it enlarges if you have a disease. What kind of disease? We call them as enteric fever. Enteric fever, commonly we call them as typhoid fever. Typhoid, paratyphoid, those kind of viruses creates this kind of disease, which is a viral enteric fever. So that kind of thing, we see that lymph nodes or Pear's patch becomes hugely enlarged, right? If you get this particular thing in microbiology, you will see this particular element once again. So then you have to understand why this particular thing is relevant. And again, they ask question or put questions on it, because you are going to see typhoid fever every day, day-to-day life. That's why they are having kind of importance in being tested in examination. So let's quickly go through these particular features which this particular small intestine have. To simplify it, we have to identify this lumen side first. Once you identify the lumen side, then we can move to this particular layers of it. So lumen to deep, we see this presence of four layers in this particular GI tract. So we have this particular small intestine split into three different domains: duodenum, jejunum, ileum. In the gross anatomy as well, as we have seen that there are features which is present. We call them as plica semilunus. These are mucosal folds, and villi and microvilli and clipped on Lieberkühn. This is what we are going to see here in this region. So this is a gross feature. You have seen the mesentery, how this particular thing is wrapping, and this particular thing, if you cut this particular small intestine inside through it, you can see this through the naked eye, this kind of like a folds. These folds, whatever you are seeing here, this folds which is running down like a at circle, which is circling around, we call them plica circularis. This is visible through naked eye, that's why I didn't mention it. But again, if you're going to see this particular in microanatomy, this is what we will be looking for, these finger-like projections. So these finger-like projections, we call them as villi. Now these things is projecting up from the surface. Now you see that it is climbing up. So we call them as evagination or bulging up. Now you see that again coming to the base, and if you see that from this particular base of this particular villi, it may be dropping down and holding a canal like this. So this is, we call them as crypts. Crypts of small intestine. We call them as crypt of Lieberkühn. So we call this as crypts of Lieberkühn. So this particular crypts, also known as the crypts of the small intestine, this thing is fitted with the glands which is present in it. That means it produces some kind of like hormones, maybe it may be producing some kind of chemical substances or lysosomal time, lysosomal enzyme, etc., etc. But whatever it is, this thing is going submarine, going deep. So this is, one thing is going down, we call them as crypts. One thing is bulging up, which is call them as this villi. These are two things that is present in here. Where they are present? They are present in the top layer. Which layer? That means mucosal layer. Mucosal layer have got three components. Cells, we call them as epithelium layer. Epithelium resting on the connective tissue, we call them as lamina propria. And then we have the muscle layer. So this particular epithelium and this particular lamina propria, they are basically bulging up. And this third layer, muscularis mucosae, they are holding it at the bottom. And then we, the beginning of submucosa, and then muscle layer, and then external wrapping layer, serosa layer. So this is how schematically they should be looking like, right? So you have to identify first thing first, lumen side and then outside lumen side. If you identify lumen side, then you see that this is the bulginess there. So this bulginess is, we call them as villi. So this particular villi, that means cells are bulging out, and this not only the epithelium, we have this particular in between this thing, we have the lamina propria. And this particular lamina propria is fitted up with the blind lacteal system and these capillaries and the venous and the arterial blood channels. They are doing the absorptive functions. So these particular projections or finger-like projections giving increased surface area so that the absorption becomes easy. Now if you take this particular cells out of here, within this cell membrane, individual each cell have got finer microvilli like projections. That microvilli looks like a brush, that's why they are known as brush borders. They are again increasing the surface area so that this particular in a quick time we can get a good amount of the absorption, super cool. Then we have this particular lamina propria dropping down, we may have a glands or may not have glands depending on some regions. These are the crypts of the Lieberkühn which is dropping down. You are seeing it circular because they are present on the circular cross sections. So they are basically dropping down here and making a depressions like this. So this is a crypts which is seeing there. Then this is fragmented layer of the muscularis mucosa. That means up to here we have this mucosal layer. Then we have this particular second layer which is submucosal layer. Submucosal may have glands, may have some kind of lymph nodes present in different domains. Some areas we are going to see these glands, we call them as Brunner's glands in some segments. This particular glands again producing some kind of secretions, maybe just like hormonal secretions or any kind of like mucus secretions which they are producing. Then we have this particular inner circular outer longitudinal muscle layer, muscular externa. Then we have this wrapping final serosa layer. So this is the schematically layers which you are going to see. So in case of the duodenum, if you pick these things, we have the mucosa, submucosa, muscularis, adventitia. Mucosa, we have this term columnar to these particular cells which is maybe column cells or columnar cells which may have a striated borders with interspaced by goblet cells, mucus secreting cells. Then finger-like projections, cleft or Lieberkühn, muscularis mucosa. These are the things. Submucosa may have glands which is present. If the glands are there, we call them as Brunner's gland. They are highly convoluted glands are there. Then muscle layer and adventitia more or less the same. If you take this particular jejunum cross section, similar to it, we have the same thing. Mucosa, columnar to cuboidal epithelium, spaced by these some goblet cells, the finger-like projections, villi also there. Crypts of Lieberkühn, they are also constant. Muscularis mucosa, they are more or less the same. The change is there in the submucosa layer, no Brunner's gland. So we do not have the glands existing on that. So we can identify which segment of the small intestine based on whether the gland is there or not. So rest is muscularis mucosa, serosa is the same. Take this particular third layer, ileum. So ileum have got this particular feature, we call them as Peyer's patch. What is the Peyer's patch? This particular Peyer's patch is a lymphoid nodules or lymph nodes which is present within this submucosal layer under this mucosa. This is present only in ileum, which is this lymph nodes is not present in the duodenum, neither it is present in the jejunum. It is only present in this small intestine segment which is belonging to the ileum segments. They are lymphoid follicles, aggregates. They are known as Peyer's patch. These things goes on hypertrophy if you have some kind of inflammation related to the disease or infections, we call them as typhoid fever infections. Clear? So this is what we are going to see here. Now see that this is a cross sections of this intestine or small intestine which belongs to the ileum. How do you know? These projections or finger-like projections are there. That means it is a small intestine segment. Now within this small intestine, if we are going to drop down to the submucosa or below the mucosal layer to identify whether this particular mucosa, submucosa region have got lymphoid collections on that. So lymphoid aggregations looks like this. So this particular lymphoid aggregates which is present in here, present in the submucosa, and you see that this is inching towards this or moving towards this particular lamina propria. That means it is hypertrophic. So this particular element we call them as Peyer's patch which is present in the submucosal layer, which is present in here, and if it is hypertrophic may move towards this particular layer. But if it is not diseased, it remains in this submucosal layer only. So it should be present like this. So this nodules as you are seeing here present in books like this. This is the normal collections of the submucosa fitted with the lymphoid aggregation. This is submucosa fitted with this one, which is practically ileum picture, whatever you see here. And in this region, what you see here, the difficulty of this particular region, we see that this particular muscularis mucosae is absent or fragmented. That's why they bars this particular holding up of this particular Peyer's patch. So whenever it goes, it has no boundary, so that it directly can encroach towards the villi or bottom of the villi, right? So this is why this particular layer which you are seeing here, this Peyer's patch present in the submucosa, can invade to this particular epithelium layer or mucosal layer, etc., etc. And then we have this particular bottom of the submucosa with this particular like a muscle layer, then adventitia. So only difference out here, I would recommend you to memorize out here, is the presence of this particular Peyer's patch. If you see lymphoid collections or circular element like this, it has to be the ileum segment. You can comment on it. And if you see glands present on it like this, that has to be like this particular layer. We have this particular glands which is very well seen. If you see this particular glands which is present well enough, glands like this which is present in here is a duodenum, and this jejunum doesn't have this particular like glands which is visible in it. So this particular layer that like epithelium, like mucosa, then we have the submucosa. Submucosa is largely filled up with the blood vessels, lymphatics and connective tissues. Then we have the muscle layer. We neither see collections of the lymphatics, which is largely seen in case of Peyer's patch, neither this numbers of these particular glands visible in here. So again, to summarize this particular intestine, we just like take to these particular 4 layers: mucosa, submucosa, muscularis mucosae, or muscularis externa and adventitia. Out of this, mucosa have got like these finger-like projections and this dropping down lift of Lieberkühn, and muscularis mucosae, which may be continuous, may be fragmented. Submucosa may have glands, may have some kind of lymph node collections, and muscle external layer, same 2 layers, and adventitia doesn't have much of significance or things to identify. They are present likewise. So we are going to see this particular histology picture of this particular small intestine. We have to identify this particular projections. We call them as villi. This particular villi is filled up with the lacteals, which is present in this region. It appears as white, and if you see blood vessels present in here, it will be picking up some kind of dyes or colors like it. And if you see this particular cells, if you zoom it, super zoom it, the surface epithelium cells, which looks like a projections like this. So this particular finger-like projections which is present on the cells membrane of this particular lesion, we call them as brush border, also known as microvilli. They look like a brush, that's why they are known as brush border. Other than this epithelium cells, we may have mucus secreting goblet cells, which may be placed in between this epithelium. This white tissue which you are seeing here like this, they are not picking up sense because these are goblet cells. They look like white dots like this. This white dots, tiny white dots which you are seeing here spaced in between this epithelium, these white dots are based on because of the presence of mucus. They are not stained. That's why they look like that. So these are the goblet cells, they are present. So go through the microscopes, 3 of them are there. Try to identify the villi. Try to identify this particular 4 layers starting from the lumen down. Then if you can identify this particular submucosa, one of them have got good number of this Peyer's patch in it. So if you see the Peyer's patch, which should be looking like this. So this particular thing, we should be looking at the bottom of this mucosa or bottom of epithelium layer, which is known as the Peyer's patch.
এইটা হ্যাঁ সাইডে ওটা মিনিমাইজ করে নিয়ে ছোট করে নিয়ে দরকার পরে তারপরে তুই অ্যাডজাস্ট করে নিবি তোর মতো করে, অথবা একটা আলাদা পেজে খোল, আলাদা পেজ। অসুবিধা নেই, পরে তুই যখন ইয়ে করবি ফাইনালি একটাতে মার্জ করে নিবি, ঠিক আছে? হ্যাঁ, এবার এটা তো পয়েন্টারটা পেন লাগা, দেখ এটা লুমেন হলো, দিস ইজ দ্য লুমেন সাইড, এটা এল দিয়ে রাখ, এল এটা লুমেন সাইড। হ্যাঁ, তার মানে এটা তোর ভিলাইগুলো হচ্ছে, এটা ভিলাই, ঠিক আছে? তো ভিলাইয়ের মধ্যে এটা উপরের দিকে লেয়ারটা হচ্ছে এপিথেলিয়াম লেয়ার, তারপরে ল্যামিনা প্রোপ্রিয়া, এটা জুম করিস যদি তাহলে বোঝা যাবে। তার মানে এইটা তোর উপরের দিকে যেটা আছে তাহলে এপিথেলিয়াম লেয়ার, তারপরে এটা হচ্ছে ল্যামিনা প্রোপ্রিয়া, সেটা ঢুকে গেল। এটা তাহলে হোল থিং হচ্ছে ভিলাই, এই পুরোটা ফিঙ্গার লাইক প্রজেকশন, সেই পুরোটা হচ্ছে ভিলাই। ভিলাইয়ের মধ্যে দুটো লেয়ার আছে, বাইরের দিকের লেয়ারটাকে এপিথেলিয়াম লেয়ার বলে। ভেতরের দিকে ল্যামিনার প্রোপ্রিয়া আছে। ল্যামিনার প্রোপ্রিয়ার যদি ফার্দার দেখিস ল্যাকটিয়ালস আছে আর ব্লাড ভেসেলস আছে, ঠিক আছে। এবার ল্যামিনার প্রোপ্রিয়াটা দেখ নিচের দিকে নেমে আসছে, এটা হ্যাঁ এটা ল্যামিনার প্রোপ্রিয়া, এলপি লিখে রাখবি। হ্যাঁ আর এটা হচ্ছে এপিথেলিয়াম, এটা এইটা।
সো হোয়াইট লাইনের সাইডে
হ্যাঁ 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 হ্যাঁ
এটা হচ্ছে
হ্যাঁ হ্যাঁ এটা এপিথেলিয়াম লেয়ারটা হলো। আর দুটো মিলে পুরোটা হচ্ছে তোর ওই দুটো মিলে তাহলে তোরটা হয়ে গেল, যেটা হচ্ছে সেটা হচ্ছে যে ভিলাই, ঠিক আছে। এইবারে তোর এখানে তলার দিকে চলে এলি, ঠিক আছে। এবারে ভিলাই থেকে দেখ এই জায়গাটা থেকে এই পর্যন্ত ছিল এইটার লেভেল, যেখান থেকে ভিলাইটা উঠেছে, ঠিক আছে। এটা দেখ তলার দিকে নেমে গেছে, বোঝা গেল। এই যে এই যে এইটা এখান থেকে নেমে গেছে, বোঝা গেল। তাহলে এইটা হচ্ছে তলার দিকে ইনভ্যাজিনেশন, তাহলে এটাকে আমরা বলবো গ্ল্যান্ডুলার এলিমেন্ট যেটা আছে, দ্যাট মিনস ইটস ক্রিপ্ট অফ লিভারকর্ন। আর ক্রিপ্ট অফ লিভারকর্ন মাঝে এই যে এটার যে টানেলটা থাকছে, তার মানে এখানে যে সেলসগুলো থাকছে, যা সিক্রেশনস আছে এখানে আসছে, তারপরে এইভাবে চলে আসছে। মোস্টলি মিউকাস প্রোটেক্টিং লেয়ার সেগুলো থেকে সিক্রেটেড হয়, যাতে কিনা এই জায়গাটাতে চেঞ্জেস হয়। কি সিক্রেটরি এলিমেন্টস থাকে এখানে, বেসিক্যালি অ্যালকালাইন সাবস্টেন্স সিক্রেটেড হয়, যাতে অ্যাসিড এনভায়রনমেন্টটাকে এটা নিউট্রালাইজ করতে পারে, ঠিক আছে। তো এইটা মার্ক করে যে ইয়ে করে এই এলিমেন্টটাকে বেশি ওয়াইড হয়ে গেল, বুঝিস। যাই হোক এটা ক্রিপ্ট অফ লিভারকর্ন এল হলো। তার মানে তোর এই পুরো জিনিসটা তাহলে দাঁড়িয়ে গেল আমার হচ্ছে
এর মধ্যে ছিল
মিউকোসাল লেয়ার। গবলেট সেলস ইন বিটুইন, যেটা এটা অতটা ভালো, এই যে দেখছিস গবলেট সেল, এই যে ছোট্ট ডটগুলো, এগুলো হচ্ছে গবলেট সেলস, ঠিক আছে। বেশ হয়ে গেল। এইবারে দেখ তুই এই লেয়ারটাতে মাসকুলারিস মিউকোসি মোটামুটি শেষ হয়ে গেছে, ঠিক আছে। এরপরে তুই এই জায়গাটাতে মাসকুলারিস মিউকোসি, এই যে টানা জায়গাটা আছে, নিম্নটার তলায় আছে, দেখাচ্ছি দাঁড়া। হ্যাঁ এইটা এদিকে এইটুকু ছোট্ট মার্কার, হ্যাঁ এটা ব্যাস। হ্যাঁ এটা তো আমরা বুঝতে পারছি যে এটা মাসকুলারিস মিউকোসি এই লেয়ারটা, ঠিক আছে। এরপরে তার মানে কি সাবমিউকোসা চলে গেলো। সাবমিউকোসার মধ্যে রিমার্কেবল হচ্ছে এই যে কালেকশনস অফ লিম্ফ নোডস, এইগুলো হচ্ছে লিম্ফ নোডস কালেকশন। এই সাবমিউকোসা দেখ অনেকটা চওড়া, অনেকটা বড়, ঠিক আছে। এই জায়গাটাকে বলি আমরা যে পেয়ার্স প্যাচেস। এবারে পিপি করে রাখ। তার সাবমিউকাসের পরে নিচের লেয়ারগুলো মাসেল লেয়ার হয়ে যাচ্ছে, তাহলে এটা শেষ হয়ে গেলে এই জায়গাটা মাসেল লেয়ার করে যাবে, এই জায়গাটা এখান থেকে। আর অ্যাডভেন্টিশিয়া মানে এই পর্যন্ত হচ্ছে মাসেল লেয়ারের বটমটা, ঠিক আছে। এটা মাসেল লেয়ার, মাসকুলার এক্সটার্না, আর তার নিচে হচ্ছে অ্যাডভেন্টিশিয়া, ঠিক আছে। এবার তুই তোর মতো করে একটু ঠিক করে কারেক্ট করে করে পুরো ইয়েটা ফিনিশ করে তারপরে গ্রুপেশন করে, ঠিক আছে।
এটা আপনি ওই স্টেজ ছিল যে এটা আপনি স্যার এইটাকে
এটা
ভিলি তো ভিলি,
এগুলো ভিলাই, এই যে উপর দিকে চলে গেছে, এটা সেন্ট্রাল ল্যাকটিয়ালস, মানে সেগুলো বড় ছোটগুলো বড়তে মিট করবে, ঠিক আছে। তো সেইগুলো এইদিকেও ভিলাই আছে, এদিকেও ভিলাই আছে, আর এটা দুটোই ড্রেন করছে মাঝখানে, এটাকে হচ্ছে সেন্ট্রাল ল্যাকটিয়ালস। মানে মানে ছোট ভিলাইগুলো কালেকশন করে বড় ল্যাকটিয়ালসে ড্রেন করবে, বা বড় এই জায়গাটা হচ্ছে ল্যাকটিয়ালসে, এই জায়গাটা হচ্ছে যে সেন্ট্রাল পার্টটা দেখ হোয়াইট, তার মানে এটা হচ্ছে ফ্যাট কালেক্টিং ল্যাকটিয়ালস আছে, এটা ব্লাইন্ড এন্ড, মানে এরকম করে যেয়ে শেষ হয়ে যাবে। আর ক্যাপিলারিস গুলো উপর দিয়ে থাকবে, এদিকে থাকবে, মানে একটা দিকে ভেনাস থাকবে, একটা দিকে আর্টেরিয়াল থাকবে। তার মানে কি ভেনাস দিক আর আর্টেরিয়াল দিকটা থেকে এর ব্লাড সার্কুলেশন এবং নিউট্রিয়েন্টস এবং অ্যাবজর্পশন দুটোই হবে। সো এটা হওয়ার পরে এটা ফার্দার বড় জায়গায় মানে আরো ফার্দার ড্রেন করবে। এটা ক্রস সেকশন দেখছিস একটা, তো সেই জিনিসটা নিয়ে ফার্দার এরকম ইয়েতে চলে আসবে। মানে এইগুলো হচ্ছে স্মল স্মল ভিলাই প্রজেকশনস, এই ঠিক আছে। এবারে এইগুলো থেকে জুম করিস, তাহলে এর মধ্যে বলছে এপিথেলিয়াম, তার ল্যামিনা প্রোপ্রিয়া, তারপর তুই বেসে নেমে ক্রিপ্ট অফ লিভারকর্ন ওই দিকটা হবে, তারপরে এই জায়গাটাতে যে শেষ হবে ওই সাবমিউকোসা পর্যন্ত। কিন্তু তুই মাসকুলারিস এক্সটার্না এইটা এই লেভেলে পাবি না, মাসকুলারিস এক্সটার্না খেতে গেলে এর বাইরের দিকে যেতে হবে, মাসকুলারিস এক্সটার্নার দুটো লেয়ার বা এটা। সুতরাং এটা ওই ল্যাকটিয়ালস গুলো জুম হয়েছে, ঠিক আছে। ওইটায় ওই যে পেয়ার্স প্যাচ যেটা আছে সেটাতে আমার কিন্তু পুরোটাই লেয়ারগুলো দেখা যাচ্ছে। তার নিচে সাবমিউকোসা গ্ল্যান্ড ট্যান্ড কিছু নেই, তার মানে এটা
এই জায়গাটাতে কিছু নেই। তারপরে দেখে এই জায়গাটাতে গ্ল্যান্ডস গুলো রয়েছে, তো সেই হলো এই জায়গাটা ইলিয়াম ক্রস সেকশন লাইকলি বিকজ অফ লিম্ফোসাইট। তারপরে এই দেখ মাসেল লেয়ার, muscularis externa, adventitia। না, সেন্ট্রাল ল্যাকটিয়ালস বড় জিনিস, মানে এই আসছে ড্রেন করে বড়টাই করছে, মানে এই ক্রস সেকশন দেখা যাবে না, মানে সাইডটা মুভ করতে হবে, সরালে যেতে হবে, তার মার্জিনে যেতে হবে যেখানে কিনা পুরো সেকশনটা দেখা যাচ্ছে। তো আমি কিছু কিছু জায়গায় সেন্ট্রাল ল্যাকটিয়ালটা দেখেছি যেটা কিনা বোঝা যাচ্ছে এখানে সেন্ট্রাল ল্যাকটিয়াল সিস্টেম বা ল্যাকটিয়ালস গুলো বোঝানোর জন্য। কিছু জায়গায় দেখেছি পুরো ক্রস সেকশনটা বোঝা যাচ্ছে, সেই দুটো তিনটে কালেক্ট করে দেখতে হবে, তাহলে পুরোটা বোঝা যাচ্ছে। সব জিনিসটা একটা সেকশনে রাখিনি, তাহলে একটা জিনিস ফোকাস রেখেছি, তিনটে ফোকাস তিনটে রকম রেখেছি, তাহলে কি বুঝতে সুবিধা হবে। কোনো জায়গাটা সাবমিউকোসাটা দেখা দিয়েছি যাতে গ্ল্যান্ড আছে বা গ্ল্যান্ড নেই, ক্রিপ্ট অফ লিবারকুম যে ফোকাস আছে, সেই জায়গাটা বোঝার জন্য তিনটে স্লাইড তিন রকম ভাবে তিনটে জায়গায় পয়েন্টার রেখেছি। তিনটে ছবি একসাথে পড়তে হবে, তিন মিলে একটা জায়গায় আনতে হবে, ঠিক আছে? বল কোনটা হবে বল। এইগুলো এইগুলো হ্যাঁ, এটা হচ্ছে এই ভিলাই, ভিলাইগুলোর থেকে আবার ছোট ছোট মানে ব্রাঞ্চড ভিলাই বেসিক্যালি। এটা সিঙ্গেল ভিলাই, এই ভিলাইটা আবার ফার্দার হচ্ছে, এইটা যে ডট গুলো আছে এগুলো গবলেট সেলস, সেন্ট্রাল ল্যাকটিয়ালস। এটা শেষ হয়ে যাচ্ছে এদের মাস্কুলারিস মিউকুস, এটা এইখানে, ঠিক আছে? তার মানে এটা হচ্ছে ক্রিপ্ট অফ লিবারকুম। তারপরে হয়ে গেল এইগুলো সাবমিউকোসে চলে এলো, সাবমিউকোসের মধ্যে এই পেয়ার্স পায়। তারপরে দেখ মাসেল লেয়ার, এগুলো ব্লাড ফ্যাটস ফ্যাটস, তারপরে মাস্কুলারিস লেয়ার, তারপরে অ্যাডভেন্টিশিয়া এই যে আউটসাইড। এটা হচ্ছে ল্যাকটিয়ালস, এটা পুরোটা দেখা যাবে না, খালি ল্যাকটিয়ালসটা জুম করা আছে। হ্যাঁ, এগুলো হচ্ছে ভিলাইস, আর এগুলো ড্রেন করছে ল্যাকটিয়ালস, সেন্ট্রাল ল্যাকটিয়াল সিস্টেম, যেগুলো এখান থেকে নিয়ে বিগার ল্যাকটিয়ালসে যাচ্ছে। বিগার ল্যাকটিয়ালস গুলো আবার ফার্দার ড্রেন করছে, যেটা কিনা কোনগুলো গবলেট সেলস দেখালাম তো, ছোট 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 সাদা সাদা প্যাচেস দেখা যায়, ছোট 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 ছোট, ওটা জুম করলে ভাই গবলেট সেল দেখা যাচ্ছে, স্টেন নেই যেগুলো,